So thank you for joining our webinar focused on the future of managed care, optimizing Medicare, Medi-Cal, and CalAIM strategies in a shifting landscape. Next slide. All right, so just some housekeeping rules. Please enter all questions through the Q&A feature. We'll have a Q&A section at the very end, so we'll hold all questions until then, but please feel free to utilize that. We will also send out a PDF copy of the presentation and a link to the recordings, and then a written Q&A that summarizes the questions and answers that we discussed today. Bye. All right, so we're joined by three lovely panelists. One is Ernesto Rodriguez. He is the Executive Director of Program Development at Kindful Restoration, which is a justice-involved organization serving the Inland Empire. We're also joined by Peter Hanna, the Senior Director of Operations and Strategic Initiatives at Clínica Romero in Los Angeles County. And Emily Brosius, which is the Director of Community Services at Beach Cities Health District, that is also serving Los Angeles County. And then our Principal and CEO at CoPel Solutions, Alan Miller. I'll let each of our panelists do a brief introduction, starting with Ernesto. Ernesto, if you're speaking, you're muted, just FYI.
Oh, sorry.
Okay.
Hello, everyone. As Allison said, Ernesto Rodriguez, Executive Director of Program Development at Kindful Restoration, and we mainly work with justice-involved persons. And the root of our organization really started with our prison work. We worked with incarcerated individuals, and then we moved into the reentry following many of our participants that were re-entering our community. And then when DHCS kind of changed who could become a Medi-Cal provider with the Senate bill that passed, we got into the CalAIM space, and it was definitely an uphill battle and a learning curve to get to the point that we're in today. Thank you.
Thanks, Ernesto. Peter?
Good morning. My name is Peter Hanna. I'm a Senior Director here at Clínica Romero. We are a federal qualified health center in Southern California with 6 service sites across LA and Orange County. I've had the privilege of serving in this role and being a part of the implementation process for our ECM and our CalAIM initiatives here, along with, as we partnered with CoPel Solutions when we first launched this program. Our clinic serves over 25,000 patients throughout the LA area, and we're proud of the work we do in providing service to those that are underserved and individuals who are unable to find affordable healthcare coverage. Thank you.
Thanks, Peter. Emily?
Yeah, hi, I'm Emily Brosius. Thanks so much for having us, Allison and Alan and CoPel Solutions. So I am a licensed clinical social worker. I oversee the Community Services Department at Beach Cities Health District. Beach Cities Health District is a public healthcare district. So we're a type of special district in California, primarily serving the beach cities of LA County, so Hermosa, Redondo, and Manhattan Beach. My department, we started in 1955 as a public hospital, but moved into preventative health about 25 years ago. And so my program has been around since that time, and we're primarily focused on providing care management to older adults and adults with disabilities in the beach cities with the intent of keeping them in their homes as long as possible and connected to the services and resources they need. We serve about 450 folks a year in our program. And we have a team of social workers that provides excellent case management work. And we're just still in, getting into the process of ECM. So we've been working with Allison and her team for almost a year now, I think, and are getting close to maybe signing our first contract with an MCP and hub. And look forward to bringing that along to our existing care management program.
And I'll let Alan Miller do his introduction.
It's a pleasure to meet everyone on the call today. Really honored to be here with our speakers. So I get a chance to work with Allison, our team here at CoPel Solutions, and really looking forward to the conversation.
Great. And then I'll be your moderator today. I'm Allison Blakemore. I'm a manager here at CoPal Solutions, have been deeply engaged in the CalAIM work with our clients for the last several years. So thank you all for joining, and a big thank you to our panelists again. We'll go to the next slide. All right, so today's agenda, we'll talk a bit about CalAIM and the program overall. We'll go into some lessons learned from CalAIM and how that's shifting what we will be doing moving forward. We'll talk about California's evolving healthcare landscape, including impacts of the Big Beautiful Bill. We'll talk about some key funding changes within CalAIM from TA to IPP and CICM. And then we'll have a panel discussion where our panelists will talk about how they've built out their programs, how they see their programs impacting care, and what they plan to do with the changing healthcare landscape. All right. Okay. So we'll start with an overview of CalAIM. So CalAIM, currently known as Medi-Cal Transformation, but formerly known as CalAIM, is a multi-year initiative focused on transforming the Medi-Cal program, really integrating non-clinical and clinical services through one point of contact called an enhanced care manager. That's their ECM portion. They also have other initiatives within it, which we'll talk about on the next slide. All right, so CalAIM is made up of around 8 different initiatives. 2 seem to be the center point, which is the enhanced care management and community supports. Enhanced care management, as I stated, is a service that allows an individual to have one point of contact. It's through a lead care manager. They're supported by a care team, including navigators, clinical consultants, and other team leaders. The ECM lead case manager really manages the complex social and clinical needs of the member, really to reduce fragmentation and streamline care. There's been about 244,000 members that have accessed ECM services since the launch in 2022. Community supports is really on the social service side. So it provides services that address health-related social needs, promoting healthier lives and reducing costly care. There's about 14 community supports, with a new one launching or that just launched this year, focused on transitional rent. About 240,000 members have accessed community supports since its launch in 2022. There's other initiatives within CalAIM as well, such as dental, long-term care, justice involved, as we're going to speak to, and population health management. All of these initiatives are really focused, again, on reducing fragmentation, improving care, and streamlining access for our vulnerable populations. CalAIM focuses on a few select populations of focus, including homeless, birth equity, justice involved, youth that might be involved with the foster care system, and then individuals transitioning from different types of care. Go to the next slide. All right, so we'll go into some lessons learned from CalAIM. So some things that we find are really important and have really realized the value of through CalAIM. One of those is streamlining management of complex members. So this is really that personalized lead care manager. We've found great value and great success in having one point of contact for a member that can manage both clinical and non-clinical care, rather than having a team managing a member's clinical care and another team managing their social service needs. Really centralizing it, again, just allows for it to be streamlined and for the member to not have to deal with a fragmented system that makes it easier for them to engage with. Second one is the integration of lived experience. We've seen how much that has impacted members' ability and willingness to engage. When they're able to work with somebody that has gone through or experienced similar backgrounds or similar spaces in life, it really helps them be able to engage and feel less judgment in their treatment. So they've seen positive outcomes from involving individuals with lived experience. Number 3 is in-person connections. So CalAIM has really emphasized the need for at least one face-to-face interaction per month with the members. We obviously still value the virtual connection if that's the only way that members can engage, but we really find that people can engage and connect with members and really motivate them with that in-person face-to-face interaction. And then integration of social and community services. So when we look at our most complex members, they're typically not just facing complex medical needs, but really have various other social service issues such as housing needs, food insecurity, maybe dealing with the justice system, and really taking that all into how they are able to engage and address their clinical needs has helped members really be successful in their treatment and their care. And then the last thing is comprehensive closed loop care coordination. So what does that mean? Really defining when we make a referral for a member, that member is going, that member is receiving the care, and that the care that they're receiving is addressing the need that we intended it to address. So really developing those closed loop referral systems through EHRs and care management systems really make it easier for the care manager to know what the member is able to address through their care plan, and helps them close the loop on that so that things aren't outstanding or there's no gaps in care. You can go to the next slide. All right, so there's going to be a continued focus on innovative initiatives within CalAIM. The state and DHCS has stated, ECM is here to stay and it's becoming more focused. We see this model of care have been developed over the last several years, and the impact that it's made through this initiative, the state recognizes, the health plans recognize. ECM remains a cornerstone of CalAIM and will not be going away. CalAIM or the 1115 waiver will be requesting an extension. ECM will not be the core focus of the 1115 extension, though there will be other areas that come into play, such as the behavioral health administrative integration, which DHCS has put a lot of importance on the integration of mental health and behavioral health services within clinical and social services as well. There's transitional rent that I just mentioned. That is the newest community support, which provides 6 months of rental coverage for members that might need this service. And then the Justice Involved initiative, which has had a slower launch over the last few years, but really a focus in building that out and streamlining that service and access to care for that population. We can go to the next slide. All right, and I'll pass it to Alan.
Okay, so I got chosen to deliver the not so great news, but a lot of opportunities. So I'm sure everyone's aware that there was a bill passed and signed the Congress and the President called the One Big Beautiful Bill, HR 1. And it is having significant impacts over the next, particularly 18 months or so, on coverage, on total premium dollar available in the market. And it really, to me, on one hand, of course, there are going to be some significant challenges ahead, right? Some significant financial hits to the market. But at the same time, on the exciting side, this is where all the work that we've been doing together for the last couple of years begins to really have to pay off. So if you think about the impacts, right, you're going to have a significant reduction in covered lives in Medi-Cal, right? Medicaid nationally, of course, is not just a California issue. Our firms are seeing this all over the country. So in California, 1.6 million people or more uninsured. There will be the initial hit with the undocumented folks for 2026, most likely. And then there will be the hits in 2027 with relation to just all of the additional administrative hurdles, right? Having to recertify every 6 months and also the work requirements. That said, as challenging as it's all going to be, the question is, okay, so how do we, right? How does what the investments the state and the feds have made already to date and are continuing to make with maintaining programs like enhanced care management, how is that going to actually help offset some of these big challenges? So we know the impacts, they're significant. The other thing I didn't talk about is that the outside of the Big Beautiful Bill, it's very unlikely that the feds will continue the subsidy increases that were created during the Inflation Reduction Act. So most likely a lot of folks will also fall off the exchange. So there's gonna be a lot more uninsured, both from Medicaid and from exchange. All of this is gonna push premiums up, by the way. So a little less impact directly on a lot of folks, although as employers, of course, you're gonna see your employer insurance go up very significantly. That's mostly on the commercial side. They're going to take a big hit. So there'd be a lot of stress and pressure in the market. Let's go to the next slide. So it's very challenging. So what? So I think what's exciting is you all, right, and we have been building capacity, right, and capabilities. In the state of California, and I will tell you in many states, there has been a big pressure for a long time for the Medi-Cal managed care plans to improve quality. And a lot of their payment can be linked to quality. So one of the big opportunities is how do we help the health plans close their quality care gaps? As we're engaging with members, right, and trying to help them close their quality care gaps, the other question is, how do we expand our enhanced care management mantra, basically our requirements, to say, okay, well, one of the non-medical issues you're going to have now is you have to satisfy the work requirements, and you have to satisfy these every 6-month recertifications. So how can we help you do that? Is it built into our workflow, right? Are we connecting you to primary care to get your care gaps closed, but are we also working with you to get you into the right type of job or educational engagement so that you can meet those requirements? Are we helping you with the paperwork? You know, the assumption is that a lot of people will fall off of coverage because they simply don't meet the administrative hurdles. I would suggest to you all that that's part of what ECM was built for, right? Enhanced care management was all about, I can't just tell someone to exercise, eat well, and take their medication for their diabetes. I need to address the fact that maybe they don't have any transportation anywhere. Maybe there are other pressures in their life, domestic violence, right, housing, that are really their priorities, and their diabetes and addressing it is not their priority. This will be the same kind of thing, right? How do we help them address and understand some of these administrative burdens that are not necessarily going to be their priority, but if they fall off of Medi-Cal, it's going to be a big challenge, even for our primary care networks, right? If someone goes into a federally qualified health center and they go on the sliding fee scale and pay $20, that's a big hit to the FQHC versus if that person's enrolled in Medi-Cal, right? If they've gotten there every 6 months, the recertification is taken care of, they've got their work requirements in place, right? Eligibility is being monitored, and now the clinic gets their full PPS rate. So I think it's really important to consider how to take the infrastructure that we've built and are building and really leverage it to support this. And I think that health plans are going to contract with enhanced care management providers that can do these things. They're going to say, how are you going to help me keep my folks engaged and enrolled? And how are you going to help me to close the quality care gaps? In order to do this, really strengthening those partnerships with other community-based organizations and providers is going to be so important. The hospitals and primary care and IPAs in California, they are going to be looking for good partners, as well as the health plans for contracting. They're going to want to know, right, who's the health plan got contracted that can help me with my members, right? Get them through these things, keep them enrolled, keep them engaged, and help close their quality care gaps. So it'll also require for enhanced care management programs to really continue to up their game, right? Do you have the right analytics, the right care management platform? Are you able to really, truly understand where the quality care gaps are and how to close them? As well as, again, do you have the right workflows in place to help them with these every 6-month recertifications and the work requirements? So let's go to the next slide. So again, this is just a reminder on the quality side, quality being HEDIS measures, right? So things like readmissions, hemoglobin A1C. This is a national issue. If you look at what CMS is saying total cost of care, fraud, and then quality. In California, though, quality is probably got a little bit of a higher perch, but I will say that total cost of care is absolutely critical. The nice thing about quality is quality links to total cost of care. So a lot of the quality measures, like avoidable admissions, avoidable emergency department, and readmissions, are directly linked to total cost of care. So again, really aligning your enhanced care management program with the quality measures for the health plans with total cost of care impact. And then finally, just a reminder that it's so critical to support the members with their every 6-month recertifications, the check-ins, right, with, of course, their eligibility and the work requirements. That's going to be an absolutely critical issue. So I guess my point is, yes, it's going to be hard. There's going to be a lot of people who are uninsured. There are going to be very high costs on the healthcare side. But the other thing that's exciting is that you all, right, everybody who's been working to put together enhanced care management and the community supports, you're now set up to be a big part of the solution. And there's a lot of opportunity there. The last thing I'll say is that this isn't just Medi-Cal. Again, CMS for Medicare has the same relentless focus. They've got to reduce cost. They've got to get people organized and have them be able to reduce their readmissions, right? Improve their quality. And so everything you do for Medi-Cal, you'll be able to do the same thing for the dual eligibles, which in California, of course, in 2026, there's some changes there, right? All the local plans will be required to have dual eligible plans now. In places like LA County, that's already in place, but other counties, it'll be new. And there'll be a push to get more people to join the DSNP programs, the dual eligible special need program versus being fee for service. So I would say to you also that everything you do for ECM, even if you can't get a contract necessarily with a health plan to do the CICM program, which is like ECM for duals, there will be opportunities for folks who are really good at closing quality care gaps and reducing total cost of care to go to plans and get various types of contractual opportunities to say, hey, how can we provide care coordination? How can we provide care management for your members to really help reduce total cost of care and really connect them with their primary care physician? And I'll hand it back to Allison.
And the next slide, Alice. All right, we'll talk about some key funding changes. So TA Marketplace funds, funding is still available through the Marketplace. We expect the Marketplace has said funding will be available until funds run out. So we are encouraging everyone to, if they want to access the TA Marketplace, try to get those applications in by December 2025 to make sure that you guys are able to access it. Once those funds are gone, they're gone, and there's not going to be new opportunities or more opportunities to work with the vendors and get help in building out your program. As I said previously, there is going to be a 1115 waiver renewal. They will be submitting an application for the waiver renewal. It will focus on kind of community supports, justice involved, birth equity, some other areas of focus. There's currently a concept paper out to DHCS. They just asked for feedback on it. So that's kind of part of the whole process. But there is an extension happening, and there will be more opportunities within that. And then want to highlight some of the future of ECM rates. So the state doesn't anticipate including ECM in the waiver extension, as I stated, but they do expect that ECM rates will be baked into health plan premium rates. So again, ECM is here to stay. We don't see it going away. So it's good to utilize the TA Marketplace to build out your program so that you have a program as this initiative continues to grow.
And the one thing we do want to share there is a reminder is that the plans have the right to contract with who they want to contract with. So they're going to contract with people who are demonstrating the ability to keep folks enrolled, keep folks engaged, and improve quality and reduce cost. And so you're going to see a lot of changes. Just like they cut a lot of the telehealth ECM vendors early on, they're going to be looking to see proof points that you're able to achieve the health plan objectives. It won't be a gimme.
And you can already see managed care plans doing that with their auditing process. So again, making sure that you guys have the systems and processes in place to run an efficient ECM program and demonstrate your quality and outcomes is really important as you guys think to grow and expand into different lines of business and different initiatives. Go to the next slide, Alice. All right, so just a little bit more detail on this. The Marketplace recently released some new guidelines for how they're having individuals access the Marketplace. They're really focusing on recipients that do not have a contract right now. So for recipients that have not received a contract or are still in the contracting process, that's really who they're prioritizing. That being said, they haven't said that they won't give a project to anyone with a contract, but they really are prioritizing those without. All new applicants to the marketplace are only allowed to access one project, which does have to focus on contracting or the contracting process. Unless, of course, they're already contracted, then it can focus on a little bit of different areas. But really suggest that if you're thinking about connecting and engaging with the TA marketplace, you connect with a vendor such as our team to understand what opportunities you guys need addressed within your organization and how that relates to contracting and the contracting process. Once you have access to the TA marketplace, there is a project eligibility process that our team supports. It's really developing kind of your project submission and that whole process. The whole process from accessing the marketplace to project approval is taking anywhere from 4 to 6 weeks right now, given their updated kind of review process and timeline. So it is a more complex process, but our team is well equipped with the new guidelines and processes to support organizations through it. Go to the next slide. All right. So as many of you know, but we just want to highlight, there is cited, IPP has come to an end. Most managed care plans have allocated all of their funds. Cited round 4 is set to be awarded towards the end of the year. With round 4 awardees, there is a progress report process. So once awardees are notified, the funds are dispersed in quarterly reports. So they have to typically prove, or they will have to prove how those funds are spent before they actually access the funds. So they will have to do, in each quarterly report, you have to do a narrative description of your completed milestones. You have to attach a pay statement. You'll have to do a description of activities. It's a rather cumbersome progress report. Our team helps different organizations complete those progress reports to ensure that they can access those funds on a quarterly basis. Again, most of those have to prove how the funds were spent and how they correlate to your project description. So our team is well equipped to support organizations, and we'll be monitoring closely as cited awardees are awarded closer to the end of the year. All right, so now we will transition to the panel discussion. We'll go to the next slide, Alice. Before we do, just want to highlight a few areas of our team our panelists on, and the way that they've optimized technical assistance through innovative initiatives. So they have leveraged the marketplace to build out their justice involved program. This organization, Kind for Restoration, is now a leading best practice organization in the Inland Empire, holding multiple contracts for the justice involved population of focus, and is really becoming a centralized hub for training and best practices, and really leverage the marketplace to do that, to build out those contracts, to build out the workflows, to build out those staffing models and build those relationships with their community partners. The CHW Training Hub, so leverage the CHW training project through the marketplace to upskill their own team, but then also to develop their own training hub to train other organizations in their area, as CHW services and kind of the practice itself is a deep-rooted connection to ECM, but also care coordination overall and what we're seeing in the healthcare landscape. These organizations have also utilized the TA marketplace to identify and engage different community partners to not only increase their own referral sources, so referrals into their organizations, but also to increase opportunities for members to get connected to other services, and to have a hub of organizations where they can review best practices, talk about members, member engagement strategies, and what's happening within the healthcare landscape. All of this really complements, again, as Alan was speaking to, some other initiatives that are coming out in California, such as the CICM model, which mirrors what we see within ECM. So really leveraging some of these tools within the marketplace is really helping people prepare also for the CICM model as it plans to launch in January of 2026. All right. We'll go to our panel discussion. Right. Great. So we're going to kick off with a question focused on how each of you have leveraged the TA marketplace and the impact it has had on your CalAIM program. And anyone can start.
First of all, this is Ernesto, and I like to share a little bit. Um, and in order to understand the contrast of how helpful the marketplace has been for our organization, we started with in this space when the bill passed to include CBOs um, as other healthcare business as a CBO, which was a new column in the PAVE portal. And the first question we asked was, well, what's a CHW? What's a community health worker? And second of all, what's CalAIM? Those were our first questions. Um, and as you know, answering those questions, I mean, they're still being answered, but that was our understanding to, what we were reading and what we were trying to learn. And then they released, we got information about the TA marketplace, and that was another thing. Well, what's the marketplace? Um, and so we really didn't know anything about anything. And I still say we don't know anything about anything because it keeps us fresh and like a sponge and learn everything that's changed, like the closed loop referral process and all the different things, the SAFT new way that they're going to be exchanging information with our capacity reports and all this stuff that you have to do, and it's like always evolving, and you have to stay up to date with the evolving landscape of CalAIM and what this initiative is all about. So I remember that around that same time we were contracting with a hub model, and the hub model was with Full Circle Health Network, and that contract or that subcontract is what assisted us in applying for the marketplace. And when we did finally get notice that we got approved, I remember I was in a past collaborative and people were asking the questions were, well, how do you get an application in the first place? And here I am, I was sitting on my lap with an approved marketplace from, I was ahead of schedule, so to speak. And so I remember going in there and trying to figure out who I was going to pick to work with. And it must have been, an angel on my shoulder, or a Gemini cricket, or however you want to, think about it. We ended up picking Cope Health Solutions. And let me tell you, that was the best choice that we've made. This is not a marketing. I'm not trying to do a commercial, but they really walked with us in a non-judgmental way as we asked all these questions that seem, even funny thinking back, because there were simple questions about, well, tell us what a CHW is. Well, what do they do? Well, how would our staff work through, somebody that becomes, how do you get certified as CHW? Like all these questions, and they were, our schedules were so busy, we would have to reschedule, and they always, whatever we needed, they made adjustments that were flexible, and we learned one step at a time. And and that was our early experience with CalAIM, the PAVE, and the marketplace. Today, we are contracted for community supports, community health worker services, and enhanced care management with ISP and Molina. With Full Circle, we have Kaiser, Blue Shield, as well. And the counties that we serve is we started with Riverside, but now we're in Riverside, San Bernardino, San Diego, Los Angeles, and Orange County. And let me tell you about what they say, what the part they shared about when managed care plans see that you do a good job, that you're actually filling the gaps. Now they send us a list of members, thousands at a time. We just got another list from them of 2,000 members. And we're grateful for the work. We just hired another person. We're probably going to double our staff in the next couple of months because it's just it's been a humbling experience to observe the growth for my organization in the last year, and Cope Health Solutions being a close partner, mentor through this whole process, to the point that we're now being hired as mentors to help other organizations navigate the healthcare space, from the PAVE portal to contracting to helping people, to helping people through the contracting stages and the onboarding stages. So it's been very humbling.
Thank you, Ernesto. Thank you for your kind words. It's great. Yeah. Ernesto is has quickly grown, holding also some county contracts as well, outside of managed care plan. Again, focusing on the justice involved. So it's been great to watch him grow and leverage different resources as he's built out his program. Pass it to Peter. I think I just saw you come off mute.
Yeah, thank you. So TA Marketplace, when you look at it from a just a newbie's perspective, I think when it was almost like sipping water from a fire hydrant. There's so much on there. Like there was a lot of Q&A questions to answer. There was a ton of like programs and things to choose. And we went prior to going to TA Marketplace, we had partnered with Cope to build our ECM program. And I think it was the best decision we were able to do. We leveraged it by not just building out an ECM program, but we built like a sustainable model for like whole person care. Because if we look at medicine today, it's not the same way we practiced 20 years ago. Patients are coming in with highly complex situations, whether it's food insecurity, unhoused, or just being at the risk of being unhoused. It's not just coming in, getting some medicine and walking out. So we were able to really build a sustainable model through some of the TA Marketplace programs, and Cope really helped us go through that. We developed a really structured ECM framework for our program that integrated, in my opinion, seamlessly with our street medicine program, because we have been actively involved in the support and medicine for the unhoused in the LA community, as we know that is one of the biggest epidemics that is going on right now. And in doing so, we're able to secure contracts with LA Care, Molina, looking at housing navigation programs that we're venturing into over this next 6 months. And we worked with the leadership team at Cope to map out workflows, patient solutions, and we work with Epic as our EMR. And if you've worked with Epic in the past, it's not the most friendly system to just make modifications to. So their team really worked with us to build like real structured programs and a really strong infrastructure. So it really helped us out. And now the team is live and we're out in the community. We have the tools and support to stabilize patients and provide care while reducing hospital and ER admission rates, which is our primary goal, obviously. So it's not just a portal, it just really opens a gateway to a lot of other opportunities.
Thanks, Peter. Yeah, it's great to hear you talk about the impact that it's had, not just on ECM, but also your mobile clinics and kind of the work you're doing out in the community. Like we've talked about, these projects really can impact your overall program operation. So it's great to hear you talk about. Emily?
Yeah, and I don't have a ton more to add. I think like really echoing what Ernesto and Peter said, and it's really great to hear all the amazing work you're doing. Like I mentioned before in my intro, we're still kind of in the process, so are close to signing contracts with a couple hubs, but not quite there yet. So really excited to see how it all pans out. But I will say that Carrie Ann, who's our chief programs officer and my boss, and I have said over and over, like we would not have been able to do this process without using the TA Marketplace and Cope in particular. I think yeah, again, not like a sales pitch in any way, but they've just been so helpful along the way and really keeping us on track in a very like kind but accountable way, and just helped us navigate all these processes. I think some of the biggest things so far have been getting us onto a new care management platform that we really need for the billing and reporting requirements, which I think will help our program overall, not just with our ECM clients. And then really helping us navigate this contracting process that we've not had to do before as a like smaller organization that's historically been able to really rely on local tax local tax system, but now that's no longer the case. And so excited to be able to be a part of the ECM program and see how that all goes.
Thanks, Emily. Yeah, that's such a great point. We have such different organizations engaging in ECM from, FQHCs, community-based health districts, all of that. And each of you have had different experiences within the healthcare system. So it's great to see how these projects have helped you guys leverage and engage in kind of healthcare contracting and healthcare care delivery. Great. So we'll move on to a question focused on how do you guys see your program growing or engaging in different programming as the healthcare landscape continues to shift, including projects and programs that we've spoken to on this webinar?
Allison?
Yes.
I had to mute myself because as I was speaking about Molina, they were calling me, right? Yeah, they're
No
like,
worries.
time for restoration. We got some more for you. I was like, yeah. But yeah,
No worries.
yeah. Sorry, thank you.
No worries. Thank you, Ernesto. And Kate, I know you just jumped on. So just to repeat, the question that we're moving to is how do you guys envision your program growing and moving forward with either ECM or other programming as you guys see the healthcare landscape shifting?
Yeah, so something that we've gotten ahead of the curveball right now is the job thing. So we have a lot of MOUs and partnerships with workforce development in Riverside and surrounding counties that when we do an intake, we are immediately identifying if they have a job, if they're wanting to get into education for a career, and if they don't have that gap filled and they don't have a job or they're not in education to invest in a career, then we're making that connection to get them a job immediately, and also connecting them with the resource with our partners to get into a space to be able to get into education to learn that career pathway. So and in addition to that, the CHW training that Cope Health Solution helped us develop is one of our big, most recent contracts that we got with 211 in California Family Life Center. And what we're doing is that part of our program includes CHW training or certification. So if for persons that are identified that want to be in the field, so we're filling in that gap. So we're getting ahead of the schedule to be able to develop and fill in that job requirement for members. And then we've also established connections with the persons that process all of the Medi-Cal renewals, the signups, and then a lot of times many of our members want to transfer from their other managed care plans. And so Molina, which is one of our close partners, they're very grassroots approach. And so a lot of times they transfer to that managed care plan, and it's a good partnership. So those are ways that we're working now just to get into a flow, so when later on when things do go into effect, we're already veterans in that process to make that connection so that they're not losing their benefits.
Right. Yeah, that's really helpful. And the big part that you're speaking to at first also is the workforce, training the right staff and getting them to a place in kind of where they can meet your members where they are, especially given kind of the workforce shortages that we see across California. Peter or Emily?
Emily, why don't you go ahead first and then I'll go after you.
Oh, sure. Thanks, Peter. Yeah, I think the kind of like I mentioned before, I mean, I think this process has really allowed us to build our capacity and infrastructure to engage with MCPs and other health plans and just the healthcare system in general in a way that we haven't necessarily been able to do before. So not only does it kind of give us some necessary revenue that we need to develop and grow our program, but gives us access to more people to serve that are in need that maybe we wouldn't have touched before. And so I think that feels exciting and important to our team. I think, with the kind of upcoming changes that we're seeing, I mean, there's both opportunity and barriers, as we've already discussed. So I think with some of these changes to Medi-Cal in particular, the ones that we're looking at most closely for our population, since most of the people we work with are 65 and older and or disabled, are some of the asset limits being put back into place for that population, and how that might affect some of our clients, and also just that I think to what Alan was saying, just some of the administrative burden that our clients experience when trying to reapply and get on these benefits. So that's something that we've been already doing a lot. We're trying to stay super on top of all the changes that are coming to Medi-Cal, and really preparing our staff and clients to be able to provide that high touch support that we already do, that they're going to need even more so moving forward.
So for us at Clinical Romero, our vision is rooted in growth and depth. For us, from the growth perspective, the patients are out there, the need is great, and we know that the number of patients that are going to be eligible for ECM and community support type of programs, that's going to be an ongoing, it's just going to continue to rise, especially among individuals that are, again, high utilizers of the hospitals, the unhoused, and people in that scope. So we have prepared to expand. We've expanded our street medicine program with our housing supports program. Our ACM program really fits in well with that. And I think the key to all of this is integration. A lot of health centers or just leaders just have a vision of managing departments individually. And I think if we start building a model of integrating departments together, not so much from a perspective of taking over other jobs, but just the flow of communication, and maybe you have case managers that can do ECM and housing navigation, but just having an integrated piece so that there is constant flow and communication between areas, that's going to be the engine that's going to allow that organization to grow. When I think about how we're serving here, we have an OBGYN program for women's health. We have a MAT services program in our substance use disorder clinic, our housing navigation programs, et cetera. We wouldn't be where we are today if we just ran independently in solo. So our goal is to integrate, work together, and develop a model that's sustainable for long-term growth. And the way that the initiatives are moving forward with CICM, we're not just relying on little short-term grants now. It's a longevity approach.
Mm-hmm. Yeah, great points. Especially as you think of, larger FQs like your system. You have all these individual programs, often that overlap with case management, and really centralizing it so you have that so you reduce confusion among your members, so they know how to access care, they know what services you have. Really will streamline that. Emily kind of mimicked that as well with your programming and your senior population and the different types of peer support and case management you offer. So it's great to see you guys both kind of utilizing programming to make sure that you guys have those processes in place to optimize your revenue. Great. Would love to hear you guys talk about any advice. I know obviously Ernesto mentioned the contracting piece, but any advice you would have for organizations considering building out an ECM or CS program over the next 6 months?
Yeah, I would want to say that don't be afraid to go for it. And what I mean by that is that a lot of times with this space, we want to try to figure everything out, every detail, build it out before you actually push play on, just going for it. But here's the thing that CalAIM is still figuring out. They're still flying the plane as they're building it, so to speak. So it's gonna continue to, change. They're always trying to improve. The managed care plans are, working, even together to improve their system. So it's gonna constantly evolve. And I would pick the right mentor, so to speak, to help you through the process. I know that when we started, I didn't even know how to fill out certain things, And you know, Allison has helped me, it still helps me with a lot of red tape, paperwork, red tape that is required to even qualify for certain projects being approved for the marketplace. So I would pick someone that can help you through those processes. So go for it. Don't be afraid to, you know, take a chance, intelligent chance, and then partnering up with people that can guide you through the process.
Great. Yeah, great advice, Ernesto. Peter, I see you're unmuted, so I'm going to pass it to you.
Sure. My advice, ECM programs and community supports, it could be a daunting task if it's not mission driven. If you treat it like a little side project, like, oh, it's kind of there, we have an ECM program, but it's not really something. But I think if you're going to go into it, you got to go into it like embedded into your core, like that your services are related to just complex and whole person care. And really the key to that's going to be just a mission aligned organization that everybody's on board with it. Success is going to depend on integration and having really good data. Obviously, it goes without saying that, you know, we partnered with COPE to help us build the program and some of our other CS programs. So that's critical, finding an expert that's going to help guide you and to lead you through different areas, because we're not experts in our field. And when you start an ECM program or any other type of new program, you try to bring in the experts to help you support that. We really did a great job by doing the right hiring. So again, for me, the key, and my team can take it to the bank, all we talk about is integrating. How do we collaborate? How do we enhance? And in the end, the big question always comes up: how is this going to affect our patient, and how are we going to better the lives of other people?
Yeah. Yeah, great point. Definitely something we see with successful programs is really making it, like you said, it's core to your organization. It's not just something you're adding in, and it really needs to integrate with your overall programming. So great point, Peter and Emily.
Yeah, sure. I think, yeah, no, that was a really good point, Peter. And I think is one of the reasons that we're so excited about this. So I think even regardless, like irregardless of what happens with our ECM contracting, I think by participating in the TA marketplace in this process, it's really helped us enhance our care management program already, just by like revamping our assessment tools, care plan tools, really looking at our workflows, all of that. So I think, and then hopefully we will, contract soon and be able to start getting some of our first official ECM clients, even though we're doing a lot of ECM type care management already. To Peter's point, I think it's already embedded in our program in the way that we serve our clients. So we're prepared to provide the level of intensity that it requires. But yeah, I think overall, just hearing that there are still funds available in the TA marketplace, I think if your organization is considering it, especially if you're a smaller organization like us, like it has been invaluable to us being able to do this. So yeah, highly recommend moving forward with it and getting the expertise and really high touch support along the way.
Great. And I know we're almost at time. I don't want to pull anyone over, as I know most people are back to back. So again, I just want to give a huge thank you to Emily, Peter, and Ernesto for taking the time out of their day to join and talk about your guys' programming and how you've leveraged the TA marketplace and how your programs have been building out either CalAIM or ECM or CS. So big thank you to you guys and the information you shared.
And
Thanks for having
Allison,
us.
I want to say thank you to you for helping our organization thrive and be what it is today in our space over here. Without COPE, I'm telling you, I don't think we'd be doing what we're doing today. So thank you.
Thank you. Thank you, Ernesto. Thank you all. I just want to call out that we will be sending, I've been asking some of the Q&A questions that have come through the chat. So we will send you guys a copy of the deck, a PDF copy, a link to the webinar, and then the Q&A